After working with them and working, with their insurance and their doctor and their family, to have that moment where they come in on their wheelchair and they walk out literally is exhilarating and extremely fulfilling.
That's why we do it. In all honesty, I just was working with a bilateral AK patient last week, and we got him from the time that he was a new amputee up in a training set of prostheses where he's only maybe 3 feet tall. They're called a short transfemoral prostheses. And just last week we got him up in a set of microprocessor knee controlled prostheses, and he's walking in therapy with the use of 2 crutches. He hasn't walked in 4 years. He's been dealing with some medical issues, but he's doing great. He's on his road back to independence. He gave me a big hug. He actually carved us a wooden sign for our office that has our nice Bionic logo on it. And I looked at him like, this is the reason I do it, man. I do it for the grandmas that'll bring me an apple pie in the wintertime, or someone that gives us a cool sign. Those are the good feelings why you do it.
I can hear them walking out, laughing. Sometimes you'll hear a patient crying. They're just so happy that they get to have their lives rebuilt. And that's, that really brings it home, especially for somebody like me who handles mostly back office.
Some of the things we do are a short process where it might be just an injury. Maybe someone just needs a knee brace for 6 months, and then they're out of our lives and they move it on and they're doing fine. But some of our amputee patients, it's a lifelong commitment with them. So we work with them all the time. Things change, you gain weight, lose weight, sockets don't fit sometimes after a while. So we're constantly monitoring them and making sure that it's working well for them.
Yeah, if a patient walks in, a lot of times they need things expedited. We need to make adjustments sometimes for some patients. They don't have transportation. Just making sure the patient gets what they need.
It really gets you once you see them stand up in the parallel bars or take their first run outside on the sidewalk in a pair of running legs that you otherwise a week ago saw them come to the office in a wheelchair. And it's just an extraordinarily humbling feeling to be able to see that firsthand.
It's amazing. It's an amazing feeling. I feel great.
Definitely brings a smile to my face.